Good afternoon, Dr. Berger.
Good afternoon, Irina.
Last session, you talked about the high cholesterol. There is a myth, and a lot of patients, they actually very reluctant to take statin, and there is a myth that statin can cause dementia. Would you please elaborate on this?
Absolutely. So statins are medications that decrease formation of cholesterol by the liver. They're very, very effective in terms of lowering cholesterol, and they've been shown to decrease risk for heart attack and stroke, both in patients who have never had those or patients who have already had them. So they're very, very useful and important medications in our toolbox. Now, occasionally there is brain fog. Very rarely I've seen it in patients, and they just don't feel quite right in terms of their cognitive abilities. You stop the medicine, it goes away. But there isn't any evidence that statins can cause dementia long term. In fact, there is a type of dementia that they prevent, which is called vascular dementia. That's from narrowing of or small clots in the arteries caused by high cholesterol in the arteries that lead up to the brain. So in my opinion, they are actually preventive of particular type of dementia, and really the only side effects that might be a problem for a small percentage of patients are some muscle soreness. There are some patients who don't tolerate that, and they do very, very slightly increase risk for diabetes over time. But with all my patients, we're working on cholesterol, we're working on blood sugar control as well. So I would say, in general, the benefits outweigh the risk with statins, but this is, of course, a very individual, patient-centered conversation that we have here. So we are Northeast Medical Practice, located in Great Neck, New York on Long Island. If you'd like to learn more about how we can optimize your health, please don't hesitate to reach out, 516-604-3418, online at northeastmedicalpractice.com, our various social media channels, my LongevityMD podcast on Spotify. And remember, everything we chat about on these videos is for informational and educational purposes only. No doctor-patient relationship has been formed, and if you have particular questions or concerns about your health, please don't hesitate to reach out to your healthcare professionals. But until we see each other next time, be in good health.
Thank you.